Hello everyone, and today I'm recalling 50 plus questions of NEET PG 2023 recall questions. So this image was asked. What is this image? This is cock up splint, which is used for wrist drop, and wrist drop is due to radial nerve palsy. So this was easy question asked. Now, prominent A wave is seen in JVP, is seen in which of the following conditions: tricuspid stenosis, mitral stenosis, or HOCM. So it is seen in tricuspid stenosis. Now, intermittent white fingers in workers with machinery. What is the cause? The cause is due to the secondary Raynaud's phenomena and due to vibrations. It is not due to cement and not due to wet hands or candidiasis. It is due to vibrations. Now, during post-mortem, temperature of the body is increased to 39 degrees Celsius. This is due to which of the following phenomenon? And due to cyanide poisoning, septicemia, or corrosive death. So it is due to septicemia, and it is due to post-mortem caloricity. That's why the temperature of the body is increased. Next question: which of the following autopsy technique is done in HIV positive patient with dead body? So Rokitansky in situ dissection is done, that is en bloc dissection is done, and not Virchow's or Gons. Now this X-ray was given, which is indicating of steeple sign. It was given steeple sign, and it is subglottic tracheal narrowing, and it is seen in Kraup. Steeple sign was asked. Now, pulmonary fibrosis with hypothyroidism. So that is side effects of which drug? I can't remember the options properly, but the main side effect amiodarone was there, and this is only the answer. So no doubt. Now, asthmatic patient with oral candidiasis, what is the treatment of choice? Cotrimazole, greasephulvin, or terbinafine? So cotrimazole is the treatment of choice, not terbinafine, not greasephulvin. Now this type of murmur was given, and this is type of pansystolic murmur, and it is given, it is seen in mitral regurgitation, MR. So this is the right answer. This image was given in this, which is limbal dermoid. It is not pinguella and it is not pterygium. It is limbal dermoid. Now, women with vaginal discharge with multiple sexual partners, which of the following kits are used? This is very much frequently repeated question, frequently asked questions, and answer is green kit is used. You have to study all the type of kits. Now, child presents with weakness, and mother has a history of eating raw egg ingestion for years. So, which vitamin deficiency it is due to? It is due to vitamin B deficiency, not due to A, K, and D. A patient farmer by occupation ingested organophosphorus and started on atropine and oximes, and 2 hours later he developed fever. So these are features suggestive of atropine toxicity. This is the answer. Now this image was given, and they asked which of the following is true about this condition. So first of all, I will be clarifying this image. This is water lily appearance. Water lily appearance. It is seen in hydrated cyst. So which of the following is true? Species involved is Echinococcus. Yes, Echinococcus is the main causative factor for hydrated disease. Surgery is not the mainstay of treatment. We try medical management and pair first, after that surgery, not FNAC and not angioembolization. Yeah, this ulcer was given, this photo was given. Many of them are confused by this is tropic or malignant, but it is a tropic ulcer present on sole. This was asked, and it is not malignant. Now, clonorchis sinensis causes bladder carcinoma, GB carcinoma, cholangiocarcinoma. This is very easy question. Cholangiocarcinoma is the answer. Now, man with midline swelling, which moves with deglutition and tongue protrusion. So this is again a one-liner, very frequently asked, thyroglossal cyst. And this is the test. The tongue protrusion test is done for thyroid swellings and thyroglossal cyst. So this is the answer. Now, swelling deep below the ear lobule causes pain due to pain due to swelling deep below the ear lobule. It is due to auriculotemporal nerve and not due to any parotid lymph nodes or not due to any facial nerve and investing layer of deep cervical fascia. It is due to ATN, auriculotemporal nerve. Now, SEEP classification. This classification includes staging of varicose veins with eczema. So with eczema it is 4A. So this is the correct answer in the clinical classification. Now, alcoholic patient with history of aspirin intake causing hematemesis and melena. So what is the cause? So easiest cause is peptic ulcer due to aspirin. This is most common cause for peptic ulcer. Now, good prognosis if the patient is in biodate 5, it's shown. So out of which is the good prognosis? The Ki67, BRCA1 and P53, they are poor prognosis. So ER positive is a good prognosis. A 20-year-old female came to emergency after ingesting floor cleaning agent, that is caustic soda and NaOH, developed acute dysphagia. Next line of management, it will be feeding jejunostomy, and later on any stenting or dilatation can be attempted after resolving the edema. So first, for enteric nutrition, feeding jejunostomy is to be done. Now, right hypochondriac pain with 1 week of diarrhea. The CT reveals abscess. So next line of management. So volume given is 70 cc. Now, abscess with the diarrhea. The diagnosis is amoebic abscess. And for amoebic abscess we will be doing percutaneous drainage first, not pair is done for hydrated disease, and surgery after percutaneous drainage is not sufficient. So first of all we will be doing percutaneous drainage for amoebic abscess. It presents with diarrhea. Now, patient with features of chronic pancreatitis with recurrent attacks of with the 10 mm dilated pancreatic duct. So surgery of choice, no doubt it is longitudinal pancreaticogestomy and not pancreaticoduodenotomy, that is Whipple's procedure. We will not be doing Whipple's procedure in this. It is done in cholangiocarcinoma and or carcinoma head of pancreas. So longitudinal pancreaticogestomy will be done. Now, old diabetic man complains of pain over the gluteal region on sitting, and after 24 hours developed discharge from behind scrotum and surgery done, black tissue is removed. So which of the following conditions can be there? So 3 options, and very difficult. Cellulitis, that can't be there because it does not spread so rapidly in 24 hours. It can be gas gangrene, it can be necrotizing fasciitis, but they have not mentioned any crepitus or foul smelling. So answer should be necrotizing fasciitis. Now, this image was given in, this is typical of varicose carcinoma of penis. So management, there will be many options within. The CO2 laser is one of the options. Topical 5-FU plus partial penectomy is the option, but CO2 laser is done in this varicose carcinomas. Now, nerve damage during lap hernioplasty cause weakness of lower limbs. So which of the following nerve is involved? So lateral cutaneous nerve of thigh is the answer, and most commonly damage and cause weakness of the lower limbs in lap hernioplasty. Now, components of Q SOFA. This is very important question, very much asked, and these are the components. I'm just mentioning the components. Respiratory rate is greater than 22 per minute. Systolic BP is less than 100 mg, 100 mmHg, and altered mental status GCS is less than 15. These are the components of QSOFA. This image was given, and it is showing that, see, due to the carrier protein, it is facilitated diffusion is there. This is the answer. Now, preterm neonate, 28 weeks, having dyspnea and bilateral lung field diagnosed with ARDS is diagnosed. So, which of the following conditions are true? So, surface tension is increased and lung compliance is decreased. Both are increased, both are decreased, or surface tension is decreased and lung compliance is increased. So, surface tension is increased, the answer is A, and lung compliance is decreased because surface tension increased due to deficiency of the surfactant in ARDS. So, this is the answer. Now, patient with potassium of 5.5 with hemoglobin urea resting membrane potential. What will be happening to the resting membrane potential? So, more positive or more negative? So, it will be more positive, as hyperkalemia and potassium more outside and less efflux. So, that will be causing more positive of that resting membrane potential. Now, partogram based Moulting 2+ with MSL. So, LSCS will be the plan of treatment because it is of obstructed labor, case of obstructed labor. Now, multiple sexual partners, painful swelling in vulva, difficulty in walking. This image was given, and this live image was given. I have just included this animated one. So, this is Bartholin abscess. Ectopic pregnancy, stable patient, 3 mm sac, 2000 HCG. So, what will be the patient stable management? What will be the management? So, oral methotrexate, single dose or multiple dose? Single dose methotrexate will be the answer in these kind of stable patients. Now, pregnant patient on line supine has faintness. So, what will be the cause? So, supine hypotension syndrome. This is the cause because of compression of IVC. Now, cervical cancer that is spreading to parametrium, what will be the treatment? Now, if it is spreading to parametrium, the stage will 2B. Now, transverse lie, age of 36 weeks and 6 days, stable patient. What will be the next management? Not conservative. It will be ECV, external cephalic version. A primary delivered a full-term male baby by vaginal delivery. She is known case of bronchial asthma. After delivery, it bleeds profusely. So, which of the following drug will not be used to stop bleeding? So, carboprost will be not be given because it is contraindicated in bronchial asthma. The uterus more than period of gestation, tense but non-tender, fetal part hard to palpate, fetal movements are normal. So, answer is polyhydramnios. Now, pregnant female with delivered healthy twins for few years back. So, GPAL score is, so twins are counted as 1 and not 2. So, G will be 2, P1, L2 and A0 will be the answer. Now, patient with complaints of pain abdomen on HMG and diagnosis and USG picture is given, that is very significant of OHSS, that is ovarian hyperstimulatory syndrome. So, OHSS, this is the picture for that. Now, 17-year-old phenotypic girl with primary amenorrhea, breast absent, uterus is absent, weight is 48 kg, height is 155 centimeter, palpable inguinal mass, and so what is the cause? Complete androgen insensitivity is the cause, not Turner syndrome. Now, disadvantages of lap hysterectomy over TAH. So, delayed identification of electrocautery burns are seen, and more time to heal, most of complications, more blood loss. This is not the disadvantages. Now, 23-year-old couple having unprotected intercourse since 6 months, and what will be advised if they are not get conceived? You have to reassure and follow up for 6 months. You have to advise the patient for this. Now, girl having primary amenorrhea with cyclic pain on PR, it revealed bulge till lower end of the vagina, so it indicates imperforate hymen. It is the most common. Now, infant with hepatosplenomegaly, thrombocytopenia, periventricular calcification, what will be the diagnosis? So, periventricular calcification more commonly seen with the association of CMV, the cytomegalovirus. Now, Koplik spots are seen in oral cavity. This is very easy. They are seen in measles, no doubt. Now, how to differentiate the rotavirus and antigen detection, stool, blood, and serum. So, in stool, antigen detection is done. So, you will be diagnosing rotavirus. Now, investigation to confirm HSV meningitis. So, PCR of CSF will be done. So, this is the investigation to confirm it. Now, child came with the sensorineural hearing loss, with bilateral cataract, with PDA, and associated with which virus? So, rubella virus is associated with this. So, stay tuned. I will be sharing more questions soon. And if you have any doubt, you can comment below. Thank you.